Good morning to our esteemed viewers and listeners on this beautiful Thursday morning of the 27th of November 2025. We are coming live from the Government Information Center studios here in Windhoek. The time is exactly 10:27. I am your host, Grace Kavei. Please do join us on our social media platforms to be a part of this discussion. Facebook is at Ministry of Information and Communication Technology. YouTube at MICT Namibia. On our information sharing session today in studio, we are joined by Dr. Jacques Kamango, the HIV clinical mentor under the Directorate of Special Programs in the Ministry of Health and Social Services, and Ms. Teopolina Cuello, the Senior Coordinator at UNAIDS. They are here to give us an overview on the commemoration of World AIDS Day on the 1st of December 2025 under the theme Overcoming Disruption, Transforming the AIDS Response. Good morning, Ms. Koyo, and good morning, Dr. Kamango, and welcome to the Government Information Center studios.
Good morning, Grace. Thank you.
Today, our discussion is in 6 thematic areas, which are global level, policy and leadership, service delivery and health system, stigma and discrimination, community engagement and leadership, and lastly, we will discuss the commemoration of the main day. Now, to start our discussion, Dr. Kamango, please take us through the nitty-gritties of HIV/AIDS. What is it?
Great. So, HIV is the virus, and this virus, someone can get it through different ways. And most of the time through it's part of the sexual transmitted infections. So when the virus is in the body, it will attack what we call the CD4 count, and these CD4 counts are taken like body soldiers. When it attacks our CD4 counts in the body, and it will use the CD4 count to replicate. Once the virus uses the CD4 count to replicate, that CD4 count will die. Once the CD4 count die, so the body immunity, the number of CD4 count in the body will decrease. And once this CD4 decrease, it will make the body immunity become very low or poor and allow any other disease to come in. And the effect of this low immunity and allowing other disease to come in will create what we call AIDS. So the consequence of the virus in the body, by decreasing the body immunity and other disease coming in the body, and create what we call AIDS.
Okay. Staying with Dr. Kamango, let's start with our first theme, which is global level. Why was the global theme, Overcoming Disruption, Transforming the AIDS, a response chosen for World AIDS Day? And what does it signify for the global HIV response?
Great. There have been a significant disruption in terms of the HIV service delivery. And this theme was chosen to respond directly to the global scale down in terms of international donor fundings. So over the past years, the international donor have been funding HIV service delivery across the world by supporting the HIV treatment, HIV prevention, care, as well as other service delivery. So with the recent cut in terms of funds, it has severe affecting countries in terms of the HIV response. And this has put a lot of pressure in countries' health system and disrupt the services with a risk of losing what we have gained so far in terms of HIV response in different countries in the world. And this theme also highlights the need of stop depending or over-reliance on external donor funded. And it's a call for countries now to develop sustainable a strategy for HIV prevention by resource mobilizing, financing, build a resilience HIV response. So it's also emphasized on the country looking at domestic resources in order for us to sustain what we gained so far and close the gap by the Vision 2030. So this theme is also a call to everyone, to countries, to make sure that to end aid by 2030, it needs a collaborative effort, it needs sustainable financing, and also including HIV response in a broader health system in the country.
All right.
Thank you.
Ms. Kwayo, which regions of the world have been affected or most affected by recent disruptions in HIV service delivery?
Thank you. The scale down of donor funding is really felt globally. The most affected countries are the low-income and middle-income countries because you find that they do not have the resources to fill the gap that is suddenly left by the gap created by the disruption. Other services that are mainly affected, particularly the HIV response services, is prevention. You find that the prevention services, access to, whether it's access to PrEP or VMMC, those are services that are highly affected globally. We're also seeing that community-led responses, these are organizations that are key in reaching hard-to-reach communities. Many were forced to close down. Globally, 60% of women-led organizations are no longer able to provide health services because of this cut and this disruption. But looking at regions specifically, although it's felt globally, the Sub-Sahara region, this is where Namibia also lies, the Southern Africa. This is the area with the highest HIV burden. So it's the region that is highly affected by the disruption. Yeah.
Okay. Dr. Kamangu, in what ways can partnerships between governments, donors, NGOs, and the private sector be leveraged to accelerate progress towards ending AIDS by 2030?
So great. Yeah, the HIV response is a multi-sector intervention, which collaboration and partnership is crucial for countries to achieve the target or to end AIDS, as we have this target of ending AIDS by 2030. So if there's no that collaboration, it will be very difficult to achieve those targets. So the government for the Republic of Namibia, through the Ministry of Health Services, is the custodian of the health service delivery in the country. So the government need to ensure that services are available, accessible without any economical strength. And the government must put policy and framework in place which make this service accessible to the community or to the beneficiaries. And top of that, the government has infrastructure and budget allocated for these services. So donors can come in with their expertise and the resources and funds to support what the government is already doing. And the NGOs, such as also civil society organizations, play also a role by engaging the community level through advocacy, education, and empowering the community to come forth in the fight against HIV/AIDS. We have also private sector can play a big role by coming up with an innovative way to keep the employee aware of the HIV status, aware about different service delivery such as HIV prevention, HIV care and treatment, and also to allow a work platform which continuously deliver message on HIV so that employee can use services available. So for this, they can also contribute to the fight against stigma and discrimination, which affect the response to HIV.
Okay, moving to policy and leadership, Ms. Koyo. What is Namibia's national theme for World AIDS Day and what message does it aim to convey?
Thank you. This year, the message for the national theme is sustaining the HIV response, ending stigma, and building resilient communities in Namibia. This message emphasizes that we need to protect the gains that we've made. We need to sustain the HIV response if we are to end HIV as a public health threat by 2030. The theme is also looking at stigma. As you know, stigma contributes, it's a barrier to accessing services. We need to end stigma in all forms and place communities at the center of the HIV response. Yes.
Doctor, please tell us which key national policies and frameworks are guiding Namibia's efforts to sustain progress and close the remaining gaps in HIV response.
Great. So the HIV response is framed within the broader national development agenda outlined in the National Development Plan 6, which we call the NDP 6. And this is the country 5 years strategic blueprint that serves as the final medium-term plan to achieve the Vision 2030. So we also have our target to achieve by 2030. So it goes together with the National Development Plan. So one of the key pillars for this NDP6 is good governance and effective public service delivery. So this plan is supported by other frameworks such as the National Strategic Framework for HIV and AIDS, which has set some targets for us as a country, Namibia, to achieve by 2028 and to enable us to end it by 2030. So on top of this national strategic framework for HIV and AIDS, the government recently launched the roadmap, the sustainability roadmap for HIV, tuberculosis, virus, hepatitis, as well as malaria control, which is also a document supporting the country how to sustain the gain and end it by 2030.
Okay. Ms. Koyo, can you explain the different domains of the sustainability roadmap for HIV/AIDS, viral hepatitis, tuberculosis, and malaria? And how does it aim to ensure long-term health outcomes?
Thank you so much. As mentioned by Dr. Kamango, the Sustainability Roadmap Part A was launched during World AIDS Day, actually last year. At the moment, the Namibian government is busy developing the Part B of the Sustainability Roadmap. And this is sort of like an implementation plan with the support of UNAIDS and other partners. To the 6 domains of the roadmap are the leadership and governance, sustainable health financing systems, health service delivery systems, community system capacity and resilience, health workforce, and health information services. Yes.
Okay. Staying with you, Ms. Koyo, on health delivery and health system. In line with the UNAIDS recommendations for ending AIDS by 2030, what are Namibia's current targets and achievements?
Yes, Namibia aims to achieve the 97, 97, 97 targets as per the National Strategic Framework. This is a 5-year plan that guides the implementation of HIV in the country. So the country at the moment where we are with the 97, 97 targets, it is according to the 2024 HIV estimates. It is estimated that 96% of people living with HIV know their status. Of those who know their status, 98% of them are on treatment. And of those who are on treatment, 98% of them are virally suppressed. So this is where we are, and it looks like we've somewhat really achieved that particular target.
Ms. Koyo, why is it called the 97-97-97 target?
Yeah, so these were the targets that were the countries were given to achieve. These are sort of treatment targets to make sure that they get people who are living with HIV know their status, they are put on treatment, and that they are virally suppressed so that they are not able to transmit the virus.
Okay.
Yeah.
Dr. Kamangu, with this achievement, what else can be done to maintain and close the remaining gaps?
Great. So there is a strong need to maintain this achievement. So as my colleagues mentioned, that the country stand at 96, 98, 98. These are great achievement, and we really need to maintain them so that we close the gap and make sure that come to 2030, we end it. So the first things I'll mention is the implementation, full implementation, the sustainability roadmap for HIV, or tuberculosis, viral hepatitis, as well as malaria control. So if we fully implement, we'll be able to achieve this, to maintain this achievement and close the gap. So the second thing is the implementation of the contract, social contract policy, which enable the civil society organization to work with the community to improve the quality of care. So these are the two things. But when you look at into this achievement, the 96, 98, 98, and if you disaggregate the data, you find that there are some certain category of population are lagging behind. These are adolescent, children, young adults, as well as men. So we need to make sure that services are integrated to reach the need of this population by intensifying HIV testing, especially among young girl and young boy, to cut the risk of HIV transmission, by coming up with HIV-friendly services to attract men to use the HIV services so that we close this gap as well. And also looking into the integration such as looking at HIV and mental health, which also affect people living with HIV in terms of adherence. And also with the aging, there are non-communicable diseases also are coming up. So looking at how we can integrate non-communicable diseases and HIV to give that comprehensive package of care.
Yeah, those are commendable achievements. Now, Doctor, what other specific strategies are being implemented to complement this achievement?
Yeah, so great. Based on the evidence, Namibia also has embarked into what we call HIV treatment optimization. This means that giving effective, simplified regimen to the majority of people living with HIV is what now Namibia is doing by providing that kind of treatment, which is very simple, fix dose combination, and effective to make sure that we sustain the viral suppression among people living with HIV. So on top of that, to strengthen again the adherence, so we are currently implementing what you call the multi-month prescription, which means every client who comes to the facility will receive a long prescription, which can be up to 6 months. And when they go to the pharmacy, they will receive also a supply of medication of 6 months. So this will enable them to stay at home, not to spend more time or frequently to come at the facility. So on top of that, there are other packages, for example, for adolescent and younger adults who are also lagging behind. There's intervention like the peer support provided to them, which is psychosocial support, just to strengthen the adherence for them to remain on medication. So on the community part, the ministry have done a lot on the community part by bringing the service closer to the community with platforms such as the Community Adherence Group. This is a group of patients, they share some common backgrounds where they select one of them as a leader who will be able to collect their medication at the facility and distribute to them. And also the ministry have also extend the services through what we call the community health posts. These are structures established in the communities to bring the service closer to the community as well as the primary health care.
Okay, now to add on to that, Ms. Koyo, what types of integrated and supportive services are enhancing the well-being of people living with HIV already enrolled in care?
Thank you. You see, integration is very important. It reduces stigma. Also, given the current funding landscape, it's really recommended that service provision, health services are integrated. Now, people living with HIV in Namibia benefit from free antiretroviral therapy. This really strengthens treatment adherence and improve overall health outcomes. Other services that are also integrated include the management of TB. As you know, TB is an opportunistic infection of HIV. Mental health care, screening of sexually transmitted infections, cervical cancer, prevention services. All these services are integrated and made available sort of as a package to persons living with HIV. And this is more especially for the adults. For the children and adolescents, there are psychosocial services. In addition to the antiretroviral therapy, there are psychosocial support services that are provided countrywide in the form of teen clubs. This is really to help the children and the adolescents to cope with the diagnosis and to accept and to live a positive life. Yeah.
Okay, now let's take a look at stigma and discrimination. Ms. Koyo, how can stigma and discrimination be defined within the Namibian context, particularly regarding people living with HIV/AIDS?
Yeah, stigma in general, it's really having negative attitudes, beliefs, and actions of isolating, labeling, devaluing a person because they are living with HIV. That is really what stigma and discrimination is in this context. Yeah.
Dr. Kamango, can you explain the difference between stigma and discrimination and how they impact individuals living with HIV?
Great. So a stigma is a fear, a kind of shame, a kind of judgment within the family, can be within the community, can be within the school, or at work, which is discouraging people living with HIV to disclose their status or to use the HIV services by taking their medication, remain adherent to treatment. So on the other end, discrimination is the unfair treatment or a denial of a right for opportunity, right to opportunity such as employment, education, or treatment due to the status of being HIV.
Yes.
So these two things severely affect people living with HIV by using HIV services, which are free of charge, either in the community or either at a facility, and affect severely their adherence, which also impact their health outcome. So with stigma and discrimination, the access to HIV services will be negatively impacted. At the end of the day, even the country aim to achieve the target also be affected.
Yes. Ms. Koyo, what strategies can Namibia put in place to ensure people living with HIV can access services without fear of stigma and discrimination?
Thank you. Since 2020, Namibia has been implementing what is called community-led monitoring, which is really an accountability mechanism to hold leaders accountable to ensure that they provide services, the right services, to the end users. Through this project, communities were empowered to demand the service that they require. Communities were empowered to know their rights when it comes to the right to health. And through community campaigns, creating awareness. So it is through services or projects or programs like community-led monitoring where communities can be empowered to really demand services and have stigma done away with. Because at times you find that stigma is felt or is experienced by those who visit health facilities, by example, a healthcare worker. And this really deters that person from going to the health facility again. So through community engagement, we can really help reduce stigma and discrimination and increase access to services.
Viewers and listeners, we are discussing the World Commemoration Day on the 1st of December 2025, which will take place in Otjiwarongo under the theme Overcoming Disruption, Transforming the AIDS Response with my studio guest. Back to you, Doctor. What role has the community involvement played in Namibia's HIV response? This is under the community and engagement ownership theme.
Great. So the community play a crucial role. So without the involvement of the community fighting HIV, it's a lost. So community they play a big role in terms of supporting each other, in terms of educating each other, as well as accepting that HIV is the reality and accepting that HIV service is available and free of charge. So community have been playing a very crucial role in terms of involving in the different campaign we have been conducting in terms of HIV prevention, like the voluntary medical mass circumcision community have been on front for this. And there are other campaigns like the U equals to U, which you call undetectable equal to untransmittable. So community have been playing a big role by displaying the message in the community to encourage those who are taking the medication to suppress the viral load so that we can apply what we call U equals to U. And they have a different network of people living with HIV in the community. They also support other people living with HIV within the community to remain on treatment and take their medication. So with this role, it's key for the country to achieve the target. And without the community, we are not going to win.
Okay. Ms. Koyo, what are community health workers and how do they support people living with HIV in staying in care?
Community healthcare workers are really frontline workers who have received comprehensive training, whether it's in HIV, TB, malaria, and other diseases. So they are able to really to penetrate into the community and reach the hard to reach. Because up to today, you still find people in the communities who may not have access to a health facility, maybe because of transport issues or distance. But community healthcare workers are really able to close that gap. Now, when it comes to their involvement with people living with HIV, apart from general information on HIV, they also provide information related, whether it's to GBV. They help establish community adherence groups. These are like mini support groups within the communities where people living with HIV can come together, not only living with HIV, also those affected with those affected by HIV come together to really discuss, to help reduce the psychological burden of HIV that individuals may have. These groups have also helped when it comes to treatment, where you find collectively they identify someone who will collect medication on the group's behalf, rather than having all, example, 10 group members go to a health facility, especially in situations where transport fare is not always available. So community healthcare workers provide really a critical role in providing psychosocial services and other, whether it's referral and other support to people living with HIV.
Okay, that's great. Now, how are young people being meaningfully engaged in HIV policy and program decision making?
Thank you. Yes, as we work with young people, they keep reminding us that nothing for us without us. So the Namibian government has made sure that through all its structures, from national, regional, district, CACOC, young people have a place on the table to give their views, to share their opinions in all decision makings, because it's very critical that they are part of these processes and are able to give a voice or give an opinion on issues that affect them.
Okay, as we are nearing our end of our discussion, let's look at the commemoration of the main day. Doctor, this year's World AIDS Day commemoration will be held in Otjiwarongo, Oshodonjupa region. Could you walk us through the program as envisioned by the Ministry of Health and Social Services?
Great. So this year, Otjiwarongo town was selected to host the commemoration of the World AIDS Day. And this will be on Monday, the 1st of December. And the event will start with a gathering at Etambi. Etambi place is a famous place in Otjiwarongo, well known. And this will be around 7 o'clock in the morning. And the community will meet there. And there will be a support from the National Defense, Namibian Defense Force, NDF, brass band, as well as Namibian police. So they will escort through marching the community from Etambi up to the Mokati Stadium. So arrival at Mokati Stadium will be around 9 for the community and around 10 for dignitaries. And we assume that around 10 the official event will start.
Okay.
And the welcoming remarks will be delivered by the Honorable Governor for Otjiwarongo region. And there will be some entertainment, some testimony for survival from the HIV, some performance. And we are blessed to have our Honorable Minister of Health and Social Services, Minister of Health and Social Services, Honorable Dr. Esperanza Luvindau, who delivered the key knowledge address. And after that, I think there will be some vote of thanks just to appreciate everyone's contribution toward the commemoration, toward the fight against HIV/AIDS in the country. And a refreshment will be served for the community as well as all the attendees. So this, in short, the program look like starting at 7 o'clock in the morning, and we're sure that by 1 p.m. we are done with all the program in Otjiwarongo region, Otjiwarongo town.
Ms. Koyo, what key activities are planned before and during the World AIDS Day 2025 commemoration in Otjiwarongo?
Thank you. As per tradition, World AIDS Day is more than just a commemoration. This is also an opportunity for service providers to take services to the people wherever they are. So there will be pre-events. I'm informed these events have already started. These are community sensitization where information is disseminated. Services, such critical services such as HIV testing, linkages to care, wellness outreach services, primary health care services, including sexual reproductive health services, condomize campaigns are already ongoing in the town of Otjiwarongo, targeting various communities. On the day of the event, that is now the Monday, the 1st of December, similar services will be provided, and various service providers. This include the Ministry of Health, civil society organization will be on site once more to provide services which include but not limited to HIV testing, the screening of non-communicable diseases, in case somebody just want to have their sugar or blood pressure checked, as well as providing information on PrEP. This is prophylaxis, as well as medical male circumcision, or the voluntary medical male circumcision, and any other information that community would like to have. As you can see, the focus is not only on HIV, but really on a different number of services that will be provided, again to reduce, as an effort to reduce stigma.
Just for interesting, Ms. Koyo, what is happening in the other regions, like pre-activities as the ones in Otjiwarongo, or?
Yes. Yeah, so traditionally, again, what happens is other regions, the key players in the regions usually come together, they organize themselves and have similar regional interventions. So you find that they might have a march, or they might have service provision. Each region is uniquely implementing activities that they might have agreed on as a region.
Okay. Okay, as we have come to the end of our discussion, any final reflections or key messages you would like to share with the nation as we mark this year's World AIDS Day? Doctor?
Yeah, great. So this year, as we mentioned, the commemoration will be done in Otjiwarongo. Despite that the commemoration will be done in Otjiwarongo, there are other regions also will join by commemorating this event. Like for Comas region, the Comas region is planning to commemorate the event in Grutop on the 12th for build-up activities, and on the 15th, I think, for the main event. So this is a call for everyone just to reflect on the gain Namibia had achieved so far in terms of the HIV response, while noting the remaining challenges to close the gap and end aid by 2030. So everyone counts, every effort counts, everyone contribution counts for us to achieve the goal. So together we can sustain the HIV response, we can fight stigma as well as discrimination, and build a resilient team where we have a community where HIV is no more a concern, where HIV transmission will be almost like to zero.
Yes.
Thank you.
Ms. Koyo, any parting shots before we conclude?
Yes, this is just to encourage the Namibian people to get tested so they know their status. If they know their status and they happen to be HIV positive and are still thinking about whether or not they should start treatment, we encourage to start treatment. And those that are on treatment are once again encouraged to remain on treatment. Yes, thank you.
Okay. Thank you very much, Ms. Koyo and Dr. Kamangu. This was a very informative discussion.
Thank you.
Thank you for having us.
Otjiwarongo is the chosen town for this year's commemoration of World AIDS Day. Please come all and enjoy the day's programs. That is all we had for you in our studios. It's goodbye.